Hello. Happy Thursday, y'all. And welcome to another episode of Bankroll Your Brains Thursdays. I'm Nicole Roberts-Jones, the Bankroll Your Brains expert. I'm always excited to be here with you for another week of pouring into you everything you need to learn to truly do, number one, get clear on your purpose. The one thing God has created you to do in this world. It's getting clear, creating a niche, all the things that we talk about. The second is a value tied to it. And the third is how to build multiple revenue streams from it. Now, what's so interesting is the second area, is the one that's the most valuable in this conversation, which is the value tied to it. And that's why our guest this week is getting ready to go all the way in. But before I introduce her, I want to make sure you guys come on in and say hello. Say hello. Tell me where you're from. By the way, if you see me looking over here, that means I'm looking at my comments on my iPad, just so I can stay focused and attentive to all of you. As my grandmother would say, don't come to this house and not speak, right? And I see it's almost 40 y'all here, so say hello. Second thing I want you to do is, as we start our conversation for this week, which is health equity, it's not just a people strategy. I know some of y'all are like, what does that mean? You're going to learn in a minute. So if you have questions, thoughts, comments, we want to hear from you. Hey, Robin in Virginia. Welcome. Hey, Zion, shalom. Where are you? Tell us where you are in the world. So again, hey, New York City in the house. Hey, Agnes, right? So again, as we're sharing, as we're pouring in, if you have questions, thoughts, comments, because listen, we're here for you. If I want to talk to Dr. Andrea, listen, we can have a good lunch and a great cocktail and not be recorded, okay? So we're here for you. So please make sure you're sharing, you're asking. If there's value in what we share, hit the share button below, because somebody else in your tribe, in your world, in your family, in your community might need this insight, right? Hey, Michelle in Houston and Jasmine in Canada. Welcome. So with that said, let's get this party started. So our guest this week, Dr. Andrea Boudreaux, is a committed healthcare executive and medical psychologist with nearly 2 decades of progressive leadership in healthcare administration and clinical practice. She is a dedicated clinician who recognizes the plight of minorities in both mental and physical health and is board certified in healthcare management. How many of you guys work in healthcare management? Hey, Zion in Indiana. Hammond, Indiana, if I could talk. Hello. How many of you guys work in healthcare management? Or your business has something to do with healthcare? Or guess what? We all need healthcare. So I guess that's related to all of us, right? As a fellow in the American College of Healthcare Executives, she is the managing partner and global head of health equity for New York-based JCG Consulting Group, where she works with national health systems and commercial health plans to improve both access and outcomes for marginalized and historically underserved communities. Hello, we a Black doctor. That does apply to us, right? Dr. Boudreaux is a champion of value-based care where reimbursement and organizational strategy is driven by health outcomes and that volume of services. I'm gonna say that one more time. That's a juicy topic. That's just that line is good, right? She's a champion of value-based care where reimbursement and organizational strategy is driven by health outcomes, not volume of services. So good. Some of y'all are wondering, what does that mean? You're going to learn. Through the integration of behavioral health and primary care, Dr. Boudreaux has helped organizations develop over $2 billion in revenue, building service lines, which improve the overall health for those communities. Now, listen, her bio is way longer than that. That's just a snippet of who she be. So let's bring her in. Hey, Dr. Andrea.
How are you?
So excited. Listen, y'all, buckle your seatbelt, because not only is she smart and beautiful, but she's about to break some stuff down for you like you ain't never seen. Plus, she's a sister girl, so we can keep you for the next 3 hours. So with that, let me welcome Anita from St. Paul. And Angela said St. Louis with focus on wellness and travel, Angels Wellness, Wine, and Travel. Okay, Angelina, girl, you in the right place, because we all about wellness, wine, and travel, but let me focus. So first, let's just start off with talking about, healthcare and this whole, it's not just a people strategy. Tell us what you mean by that.
First, let me say thank you so much for having me here. I am such a fan of blackdoctor.org, and Nicole, you are just a gem in my life, and I am so excited to have gotten to know you. So I'm just thrilled to be here. This is my passion. For so long, I keep me honest, because sometimes I forget that this is not just healthcare people, right? So I'm going to use some healthcare examples, but this can be applied across industry. We look at DEI strategies as the people. It's usually housed in HR. and it's usually about bringing people to the table.
Right.
So diversity is that, right? I want to bring the right people to the table. Health equity is the work and the outcomes that you're getting. So for those of you who are not in healthcare, equity is about the business that you're doing to meet the needs of the community you serve. And so it's not just about hiring people, it's also about changing your business model so that you can be impactful. For me in healthcare, it's about the health outcomes and the closing disparities for those people who touch our service.
And that's so good. As you're sharing, what's popping in my mind. So let me tell you guys, my mother for over 30 years worked in medical billing. So every summer, I don't think I told you this, every summer, against my better judgment, because I didn't have a choice, my mother made me work during the summer. I used to have to work for her billing service. So I'm sharing that with you because I saw how healthcare shifted to going from health focus to revenue focus, right? It's like, what could I charge or bill to get paid for, instead of what service does this person need to feel better? And on top of that, when we talk about equity and inclusion, meaning we want the same service our other counterparts, y'all know what I'm saying when I say other. We want the same service. We want the same, everything. So tell us why. And I think a lot of us don't think about healthcare and think about diversity, equity, and inclusion, right? We don't think about those two. So tell us, the difference between DEI and why this is such a needed topic in healthcare. Before she shares, I want y'all to get this. Even if you don't work in healthcare, all of us need healthcare. This is a one system that every single person has to go to. And so don't hang up and think, oh, they talking about healthcare. This doesn't have to do with me. It does. The fact that most African Americans don't take their bus to the doctor, which is a whole show in and of itself. Right. So that thing right there. So just tell us about why this is so important, the DEI in the healthcare landscape.
So it's just that, like I said, diversity is who's at the table. Inclusion is making an environment where those voices are able to be heard and valued. Equity is taking what we talk about at the boardroom table and going out and making it work in the community. So why it's important? Yes, you need leadership in your, for me, hospital. You need leadership for you on your board. You need leadership on with your advisors. You need diversity, because none of us will be profitable if we have a yes tank or some thought tank. We don't have the diversity of thought. So diversity of thought is always important. But if you don't use that, if the voices are not heard, and so you can sit at my table, but you need to, this is what we do, right? We're taught to be seen and not heard as children. So if you bring this diversity of thought to your table, but don't allow them to weigh in and be a part of the work, that's where inclusion comes in. Inclusion is creating an environment where their voices, yes, they're sitting there to look nice for your website, your picture, but are their voices heard? And then the equity is taking it yet another step further and bringing the business into it. I'm going to give, this is some free press to an organization that I think did an amazing job and helped me get to where I am today. So I didn't tell you that I was going to do this, but HCA did a phenomenal job. When I started with them, HCA had this program called the Executive Development Program. And HCA, I used to tell people in the early 2000s, if you saw a Black hospital executive, a Black hospital CEO under 40, they went through that program anywhere in the country.
And sorry to interrupt you. What's HCA stand for?
The Hospital Corporation of America. It's the largest healthcare organization in our country. And so they did a phenomenal job of bringing the Black and brown people to the table. Healthcare is a old white man led industry. And HCA said, we've got to do something about this. And we have the largest footprint. So they created this executive development program. Now, it wasn't only for minorities, but this is where you saw a lot of minorities be able to enter the industry as leaders. So that was the diversity piece.
Mm-hmm.
How they took it a step further was we got to lead services. So it wasn't that we were sitting there and taking notes and just watching these people and learn, just shadowing them. No, we were responsible for outcomes. We were given directive and oversight over services. And so it groomed you to become a senior executive within the organization. And many people who were in that executive development program are CEOs today. And so that's where that was the inclusion, hearing their voice. Now, let me show you what the equity was. When HCA was looking for places to invest capital and where to look for new expansions and how to expand their footprint, looking at market data and saying, where do we have poor outcomes in these communities? Where is there a higher ER utilization? What can we do to improve the medical outcomes in these communities? And HCA started investing in satellites. And so you're seeing it's not just this flagship in the medical center, but now we have satellites all across some of the market reach. That is the equity, because now those people don't have to travel all the way into your medical center. They can go into this clinic, into these medical office buildings and get this care. And so I'm going to give them a shout out just because HCA has been doing health equity before we were calling it that. So let's talk about you. Oh, go ahead.
Before you shifted, I want you guys to get this. This is so yummy. But as we talk about Bankroll Your Brains, I want you to get that there was a need present. And so many people overlook a need, especially in a huge system like healthcare. Healthcare is huge, right? And so as you're sharing that, Dr. Andrea, what's popping in my mind, I'm not going to say names because I don't have permission. I have a client who, when I met her, she was a chief innovation officer for a health insurance company that a lot of us have. I'm not going to say what the name of the company is, right? And what she kept seeing was the same thing you're talking about, the disparity of who gets insurance and who knows what's available to them. Right? It's one thing to get it. It's another thing to know it's available. Because some people get it and some people don't. Even as an entrepreneur, there are all kinds of alternatives for us that many of us of color don't know that are available to us. And it took someone like her, not gonna say her name. She's our soror too, by the way. Dr. Andrea is my sorority sister. In addition to we're in another organization together. So it took this particular individual seeing the issues from inside a system that she realized in order for me to really affect change, I have to come out of that system. And she started her own business. So I want you guys to get that this does correlate. But at the same time, I also want you to get this healthcare conversation because it's so important to all of us. So sorry, go ahead. I just had to drop that in real quick.
So and I'll give, let's take it outside of the healthcare space. So I remember when I moved to New York, I'm going to talk about clothing cleaners because I'm going to take it as far away from the hospital. But what they recognized in Manhattan, you have to have valet service. I couldn't even tell you where cleaners was in Manhattan because the needs this is the need that this particular community had. Now, if you go to start a dry cleaner and you're in Manhattan and then you try and replicate that in, say, a Houston, Texas, which is where I grew up, you don't need a valet service in Houston, Texas, because Houston is so large, and that's not the expectation that Houston people have. So it's knowing so this equity, we'll take the health piece off for a second. Equity and why it's important is understanding your market, understanding your community, and providing them with the resource they need. If you've gone to any any DEI, workshop and they have PowerPoints, you're going to see this one pictographic, and it's of these 3 children at a fence. And so the first picture is trying to show equality. And so it gives all of these children the same step riser. And because they're of different ages, the youngest child still can't see over the fence and can't see the game because they all got the same thing. What equity says is no, sometimes you have to invest more in some people. And this young child who's shorter than all of the other two needed a bigger riser because he needed to be able to see over the fence.
Right.
And so what equity says is let me give you what you need so that we can level the playing field.
Ooh, wait, I got to stop you there. That's good. Somebody type that in the chat. Let me give you what you need so we can level the playing field. That's so good. And somebody's watching us from Somaliland. Am I saying that right, Hassan? So good. That's so good. Okay, go ahead. Sorry, I had to stop you.
No, and so from my lens and what I do every day, it's about access to care. And it's about the resources you need. So what are some of the barriers to you getting to the doctor, to you getting to the hospital, to you getting the medication you need? That's my job.
Right.
But for you in your industry, what are the barriers to your clients, your customer getting to your product? And so what health equity says is, what equity is stop with these cookie cutters. You can't just duplicate your service everywhere and it be the same thing.
Woo.
Every market is going to need something different. And it's up to you as the owner and the leader to say, let me understand what my market needs and then be able to address and again, give you what you need, give you that bigger riser if you need it to get over the hump. So in Manhattan, it was a valet service. In Houston, it's different hours. And, there were different things. And so my favorite dry cleaner in Houston had that in by 9 and you can pick it up the same day, out by 5. That was my favorite thing. In Manhattan, what I wanted was, I didn't care when, because you pick it up when you get to my building. I needed you to come and pick it up because I wasn't coming and I'm not walking down Lexington Avenue with, a laundry bag. So I needed that. Yeah. I didn't need that when I lived in Houston. So it's about understanding your market and finding how to get them the service that they need so that they want to engage with you.
And the biggest thing you just said, which is so good. I hope you guys are taking notes because she's dropping gems and y'all don't even realize. That's why I keep stopping you because this is something good. So it's not cookie cutter. I think think about healthcare, y'all, and how many healthcare systems do the same exact thing over and over and over. And when they do that, they're leaving things out, right? They're leaving out critical factors that shift, whereas a lot of these systems may have started back in the 40s, 50s, 60s. Now it's different. And now COVID has happened. Now COVID has happened on top of that. So what has really, or how's the DEI work shifted because of COVID? And I want y'all to get all these shifts that are happening. And I want you to start paying attention now. Now that you've met Dr. Andrea, you can say, listen, I see that y'all are behind because Dr. Andrea told me, right? And don't get her in trouble. I'm going to
don't get rich.
But I want you to now. Go ahead.
What COVID did was give us the ability to talk about it very transparently. There were so many people. If you go back, I tell people all the time, my days are just running together at this point. But go back to May and June of 2020. Every day it was just more and more death. It was overwhelming. Some of my colleagues who are still in hospitals in New York would be in tears. Just one of my colleagues said that she had 8 deaths an hour in her hospital.
Oh my God.
We heard about it, the refrigerator trucks, and there just wasn't room in the hospital morgues. We heard that. Yeah. If you weren't in New York and didn't see it, you may have been a little detached. But let's go back to that time. The most surprising thing to me were the number of people who said, this is impacting Black and brown people more. And I'm like, what have I been doing my whole career that you don't understand that you didn't get that's what happens in healthcare. That Black and brown people are always hit hardest. There's some people say when America gets a cold, Black America gets the flu. And so there were so many people who didn't understand healthcare disparities, and COVID allowed us to talk about it because those figures were on the news all the time.
Yeah. Yeah.
It's all we saw. And so now what you have is this upsurgence of chief diversity officers and global heads of health equity and organizations creating institutes for health equity, and how offices of DEI in higher ed, in business, in healthcare. It's just everybody now wants to understand,
Yeah.
how do I address this equity? There's money there. I mentioned that I worked for HCA, and I love that organization. They taught me everything I know. That's where I cut my teeth as a healthcare executive. HCA is a for-profit institution. So I tell people, if you're not successful, you won't be there. And so as a for-profit company, patient outcomes are that's the focus that we had. But you better believe, if it didn't make dollars, it wasn't going to make sense. And it wasn't going to get past the conversation space if I couldn't make it make fiscal sense to the organization. And so I'll say the same thing outside of healthcare is, how do you monetize this equity? How do you say, so when I shared that we've grown service lines, that wasn't, the focus was on getting the resource that the community needed. Right. It wasn't about but you better believe that bottom dollar was being monitored. But look at the outcomes. And so I often tell people, if you don't have a margin, you can't achieve your mission. And so it is about understanding the business, and I call it operationalizing diversity, because it's about creating a business model that helps you to reach those places that you've not touched. It's how you develop your business plan. What needs are not being met? What communities can you touch, and what can you do differently to build in that community?
Right.
When I was in practice, one of the things I did, I shifted my hours 3 days a week from 8 to 5, which is what most practices are, to 12 to 8, because I'm a pediatric, my practice was in pediatrics. And so I didn't want my patients to have to get out of school every day. And so mom has to take off of work to bring the child to me, then bring them back to school. They're missing school. So my 5, 6, 7, and 8 o'clock appointments had a wait list because people were wanting to get care. And now there's a space for them to get that care. So guess what happened when I became an executive? I made all of my practices do that. We all need to have hours outside of 8 to 5 because everybody doesn't have PTO that they can take to go to the doctor. Those hourly employees can't just leave for an hour. So how do we address, and again, if we take it away from the healthcare piece, how do you address the needs of your community? How are you available to them? That's so the equity piece.
That's so good. Look, and y'all saw me taking notes because she's dropping nuggets over here. I'm like, I know I'm not going to remember that. So what you just said this a few minutes ago, and I was writing fast and trying to look on the camera. I was like, let me just ask her. Stop trying to write it. If you don't have a margin, you can't fulfill your mission.
That's it.
And so I want y'all to get this. So it's not about selling; it's about serving. Okay, yes. You focus on serving, which is what she's been talking about this whole time. But at the same time, you need money, or else you can't serve. Okay, so you can't do what you're doing for free. You've got to have a margin.
Yeah.
But without that margin, your mission can't continue. So this is such a great conversation. And, we can keep talking, but Dr. Andrea has a gift for some of you. Now, let me say this before she says it, because some of y'all go like, oh, I'm going to email her because I just want to talk to her. No. She's going to tell you what her gift is. I need you to only reach out to her if you're serious. Okay. So I'm pulling it up. Share with them the gift, a free consultation. Tell them who qualifies and what is it about.
So my expertise is in healthcare. And so helping health systems identify ways to close healthcare disparities and improve outcomes for marginalized communities. But what we've been talking about today is that this really is transferable to other spaces. So if you have a business that is trying to understand how to look at your market with a equity lens, to understand how to get that bigger riser, like we talked about, I'd be happy to sit down and talk with you and see if the work that we do might align with the needs your organization has. So that conversation would be at no charge to you and your organization. I'd be happy to spend an hour with you to look at what your challenge is and how we can help you identify opportunities for growth.
How to fill that gap. So again,
Yeah.
I don't want Dr. Andrea saying, girl, these people that emailed me weren't serious. So only, and I'm saying this because listen, she's been doing this for over 20 years. So her insight is valuable. Don't waste her value. Only come to her if one, you really want to move the DEI needle forward in your business or organization. And listen, if you know someone that works in the healthcare system or someone that is outside of the healthcare system but is working in it and really needs to shift that needle to really to be able to serve more people. Again, if you have no margin, then you can't fulfill your mission. I'm just saying. So if you're ready to really understand the gap in that, then reach out to her and see if, and again, it's free. So, and I'm saying that because again, her time is valuable and I don't want her wasting time with people just curious. No, not curiosity. People that really know they need support and they have a gap and they want to fulfill it. So let me say thank you to you, Dr. Andrea. You are always a wealth of knowledge. Let me tell you something. I've only seen her in person once, but we're on Zoom all the time. So every time I'm with her on Zoom, I promise you, I walk away with some nugget. She don't even know I'm taking notes. I'm always taking notes. Somebody said, hold on, let me put this up here. So informative and needed discussion. As a mental health provider, also equity in insurance copays often becomes barriers to access to care with rising beds. Does that mean beds? It says bees, but you probably mean beds, right? Or needs. Maybe it's needs, rising needs. So I'm typo queen. So I got you. Camilla. Thank you for that. Thank you for that. And it is informative. And I think,
Yeah.
as entrepreneurs or people that are really wanting to start businesses or, are thinking about it, we often think healthcare conversations don't apply to us.
Mm-hmm.
So not true. So
Mm-hmm.
thank you for being willing to come in and share some of your expertise with us. Thank you for all that you do to make sure we're included. I appreciate you and I honor you, girl.
Thank you. Thank you. It's been great being with you. This has been a fun time. I love talking about this.
Her passion is up there. You can tell. Thank you, girl. So with that said, y'all, I'm here every Thursday for 30 minutes. And I love bringing people like Dr. Andrea on because you can see the passion, her purpose, her power just coming through the screen, right? And Angelina said very informative and loving it, right? I'm so excited. So with that said, again, every Thursday I'm here. So those of you that have questions, thoughts, something you want me to talk about in our episodes, send an email to byb@blackdoctor.org. Email us your questions, your thoughts, your comments, or listen, you don't have to email them. Here's one better. Follow me on Instagram and send me an inbox message. Send me an inbox message on Instagram and tell me what your questions are around bankrolling your brilliance. Maybe understanding your purpose and the value tied to it, or how do I begin a business based on the thing that I'm really, really great at? You see, Dr. Andrea took her degree, her medical degree, and now she's a healthcare executive. If she's not showing you how you can take your gift and shift it into another arena, I'm just saying. In addition to the expertise she has because of the years she's been in the field. So if that's you and you really have questions or thoughts or comments about it, number one, follow me on Instagram because I give content and insight and tools every day, at least 2 or 3 times a day. But in addition, send me an inbox message there and let me know how I can bless you. And maybe your conversation, your question might be the topic I at least once a month come in and pour into you. So with that said, I'm here every Thursday, always excited and humbled and blessed to hold the space to you for you to go after being the highest and best version of who God created you to be. Again, thank you to Dr. Andrea for Dr. Andrea Boudreaux. I love to say Boudreaux. It just sounds so, I just love to say it. But anyway, thank you, Dr. Andrea. She's backstage. She can hear me. So thank you for all you are and all you do for sharing with us today. So listen, I'll be back next Thursday with another guest pouring into you all you need to know to live a purpose-focused life and to bankroll your brains. I'll see you next week. Bye, y'all.